Let's be respectful of one another when other people are speaking. Please speak loudly and concisely. Remember, you are going to be on YouTube, so we want to conduct yourself, accordingly. And without everybody's minds clear, we're going to start.
Okay.
Good morning and welcome to the Summit Women's Network Talk Show. I'm glad to see you all this morning. Thank you so much for coming. It is a pleasure to have you here and to be in front of me. I appreciate you guys. Thank you so much. Today we're going to talk about trichology. We have a trichologist with us. Her name is Dr. Linda Amerson. She's going to tell you a little bit about what trichology is, because I'm sure some of you want to know and want to have some information about it. So I know a little bit, but not enough to even begin to educate you guys. So we're going to talk about hair loss, alopecia in particular. I know a lot of people suffer in silence. So we need to talk about these things, just like everything else we need to talk about. So without further ado, I'm going to bring to you Dr. Linda Amerson. Good morning, Dr. Amerson.
Good morning. How are you?
I'm fine. Good to see you.
Good to see you too. Good morning, ladies.
Good morning. So we're going to just sit down and have a little talk. Dr. Amerson, first of all, can you tell everybody what trichology is?
Absolutely. Trichology is the scientific study of alopecia and scalp disorder conditions. Alopecia is the medical term for hair loss. It began in 1902 in London, England. And in the United States, it really was brought to the forefront in the 1940s. So it is not a new science. It's been in existence for over 100 years. And most of the trichologists that actually began back in 1902, once they became certified, they were very, very busy in their clinics servicing their clients. So a lot of the marketing and advertising was not done. So therefore, a lot of consumers, it wasn't widely known as far as the print media, social media, and back then they didn't have social media. But a lot of print media, newspapers, television, there wasn't a lot of marketing for that. However, that has really changed over the past 30 years. So some of you may have heard of a trichologist, and some of you may not have. So today, I'm really excited to be here to shed some light on the scientific study of alopecia and scalp disorder conditions.
Well, before we go any further into trichology, can you tell us a little bit about yourself and where you study?
Absolutely. I'm an entrepreneur. I consider myself a serial entrepreneur. I've had my business over 35 years. I'm the owner of LA's Hair and Scalp Clinic, which is located in Arlington, Texas. I attended the International Institute of Trichology in Madison, Alabama. And my professors were the late Dr. Hattie Thompson and also Dr. Tariq Madyoun. And they were very hard on me, I will say that. But I made it through the curriculum. And so it was a very good investment for me. And I've done a lot of marketing and advertising since I've been in the field. And I love what I do.
Oh, wonderful. Wonderful. That's great, because when you love what you do, you're good at it, right? Everybody agree with that?
Yeah, that's right.
Absolutely. Dr. Amerson, tell me, do you want to tell us a little bit about you personally, about yourself? Because people are always interested in the behind the scene, not the doctor, but the person and their character. So can you tell us a little bit about yourself?
Okay, about myself. Well, I'm a Christian, number one. So I put God first in everything that I do. As far as something I like outside of work, I do work a lot of hours. I love the arts. I love the theater. I love Broadway musicals. I love to travel. And there's so many places that I feel God created for us to go and visit and to see. So I love to travel. I've been really blessed to travel throughout the United States as well as abroad. A lot of travel in the Caribbean islands, both business related, and I've extended those stays to have a little vacation. Actually coming up in October, I'm scheduled to go to Barbados, and so I'll be doing a 2-day seminar there, and I've extended that. I'm going to have a vacation. And I've also been to Africa, which was truly an experience. And I am active in my church, but because I'm a business owner, I do have some limitations as far as not being able to be as active as I would like to be. I love trying new restaurants, and Aria and I, we have tried a few new restaurants together.
Yes, we have.
And so those are just some of the things about me.
Thank you. Thank you. You guys know I can't sit for too long. I know I got this neat thing going on today. As you guys can see on the overhead, I don't know if someone can get a shot at. Dr. Amerson is doing her second cruise, and we're going to talk about that a little bit more later on. Right now, I want you guys to get a really good understanding of alopecia, about your hair and scalp, and I don't know what this all entails, but I know that this is going to teach us a little bit more about our hair and scalp and what Dr. Amerson does. So at this time, I'm gonna turn this over to her, not my microphone. I know I don't turn it. Okay, I'll give it to you. We're gonna turn this over to Dr. Amerson and let her give you some information. Now, what I'm gonna ask is that you guys hold your questions. You know, if you need to write them down or whatever, like me, because I have lots of senior moments. Hold your questions until she's done, and then when she's done, we're gonna do a question and answer period, and we're gonna do my favorite part of the show, which is
door prizes.
door prizes! You guys know I work real hard for that. Okay, so after that, we're gonna do our door prizes. So without further ado, Dr. Amerson, do you want to?
Yes, so everyone can hear me. Okay, ladies, I'm going to go through my PowerPoint presentation. This gives you more of a visual of what I'm describing, and I find that is more beneficial to my audience because of some of the terminology that I'm using, but I'm going to try not to go over your head today, but I do have some visual pictures that I will show you, and you'll have a better understanding of what trichology actually is. Understanding trichology. The topics will include what is trichology, in the beginning, your main tools, the main steps to healthy scalp and hair, alopecia captured and product knowledge, before and after success cases, Cruise with a Purpose 2012 and 2015. What is trichology? As I mentioned before, trichology is the scientific study of alopecia disorder conditions. And alopecia, again, is a medical term for hair loss. There are over 75 different categories. So that's what I personally address in my office. So we are actually the bridge between the cosmetologists and barbers as well as the dermatologists. So we're right in the middle. These are two of my professors. This is the late Dr. Hattie Thompson, and this is the Dr. Tariq Majin. And that's located in Madison, Alabama. These are some of my other colleagues that attended the Institute with me. I'll go back. Okay, in my practice, I actually use two microscopes. One of them is called a polarized microscope, which is this one. With this one, I'm actually looking at the hair bulb and the hair strand. So I can actually tell you how much water you're drinking, what your nutritional absorption is, if you have any hair shaft defects, if you have any genetic factors, that is confirmed as well. I can also tell if you have any chemical overprocessing, whether it's hair color or any other type of chemical product that's used. So a number of different things that I can see here, as well as how healthy or unhealthy your hair is actually growing. The second microscope, this one is called my tricholoscope. Now with this one, I'm actually showing the customer on my television monitor how healthy or unhealthy your scalp is. And this is a very eye-opening experience. As I just mentioned, the microscope tells how healthy or unhealthy the hair is actually growing. These are two examples of two very unhealthy hair strands. This hair is actually about to break. This is what we call Trichologist nodosa. And this is another hair strand that is split very, very severely. And again, I can tell you nutritional absorption, water absorption, hair shaft defects, etc. These are examples of 4 hair strands under the polarized microscope. Out of the 4 hair strands, this one is actually the healthiest. Looking at this particular hair strand, we see a lot of black pigment within the strand. So that tells me there's a lot of damage which has resulted there. Am I holding it too close? Okay. And here, this tells me that there is an unhealthy hair bulb. Here also, this is a very unhealthy hair strand. There's an accumulation of sebum around the hair follicle and the hair bulb there. Here I see another very unhealthy hair strand. We see a lot of dark black pigment there. And then here, this is the healthiest hair strand out of the 4. This is an example of a very damaged hair strand. Now this is normally what the consumer would see when a person has hair that looks very, very frizzy. Under the microscope, this is what I see. Major difference, correct? Okay. So this is very, very split. There's a lot of damage to the cuticle and the cortex layers of the hair strand. Very, very damaged. So the only solution would be a haircut in this case. These are 2 other examples of damaged hair strands. This is also under the polarized microscope. Okay, replacing combs and hairbrushes. Grooming tools. It's very, very important to replace grooming tools over a period of time, especially when the teeth begin to break. These are actually combs that I took from some of my patients where the teeth were broken. This was actually causing the hair to be pulled out. Okay, so I told them it was time to replace those combs. Here, this is a vintage hairbrush. It was time for her to replace that hairbrush. Okay, anyone in the room who uses this type of hairbrush? The vintage hairbrush. Okay, very good. Now this hairbrush here, this brush had some bristles that were also broken, and I took that from one of my clients. So it's very important to replace your grooming tools periodically. Okay, cleansing your grooming tools. One of the easiest ways to cleanse them is in the washing machine. Have any of you ever heard that before? Okay. What you want to do is use very, very hot water and put your combs and brushes in there. You're not going to turn it on, no agitation. Allow it to sit with the detergent and Clorox. So Clorox is also going to help to kill some of the other bacteria and other things that may be on the brush and the comb. Allow it to sit for about 15 to 30 minutes, and then you remove them from the washing machine and rinse thoroughly and just lay them on a towel and allow them to dry. Other ways you can cleanse your combs and brushes is in a bowl, a plastic bowl, again with very, very hot water. And also you can use the bathroom sink or the kitchen sink. So those are some other options for you. But it's very important to cleanse them on a weekly basis. Oh, also your pillowcases, those need to be cleansed and changed. If you wear scarves or any types of caps at night when you sleep, those also need to be cleansed on a regular basis. I try to encourage all of my patients, when you purchase something to cover your head at night, purchase 2 at a time. So when you purchase 2 at a time, when one is clean, you use that. And once you get your hair shampooed, you can use the other one. Okay? So that way you're not recontaminating your hair with dirty scarves. That has happened in many cases, I've seen that. So purchase 2. That way you have one that's clean, and then while you're using the other one, once it becomes dirty, you can always use the other one. Okay, this is an example of a pair of hair clippers that a lot of the barbers will use. This is one that is contaminated with hair. Okay, this is very nasty. And some barbers are not as clean as they should be, even though they're regulated by TDLR. So I encourage all of you parents who have grandchildren, if you take them to the barber shop, make sure once you bring them back to the home that they will shampoo their hair. Please make sure that they shampoo their hair. And you can pass that information on to your children or your grandchildren as well if they have children. So it's very important for them to shampoo their hair after leaving the barber shop. A closer look at alopecia is more than a conversation, it is a lifestyle. Now this is a teenager, Kayla Staples, and I'll elaborate more about her shortly. Okay, these are some of the various forms of alopecia. I'm going to go quickly through this segment. So this is marginal alopecia. This is another example of marginal alopecia with regrowth. This is alopecia totalis and psoriasis. This is alopecia telogen effluvium. Now looking at this picture, you wouldn't think that this person has alopecia, correct? But she did. So we were able to correct her problem. This is an example of chemical alopecia. There's cicatricial alopecia in the male. There is another example of cicatricial alopecia and furrows in the scalp. Now these 2 particular disorders are irreversible. Another example of lace front alopecia and genetic alopecia. This person had 4 different types of alopecia and scalp disorders. And then we have alopecia areata in the male and female. Another example of alopecia areata. This is a chemical burn. This is a scalp condition as well as alopecia in an individual. Children. Now children are near and dear to my heart. These are 4 different examples of various types of alopecia. In the top corner here, this is a child that has alopecia areata, which has progressed very rapidly, and the child will have alopecia totalis. This is an example of a child who has alopecia universalis. Now this child has a systemic disease, which caused her to lose all of her hair. This is an example of a child who has alopecia, another form of alopecia, of hair breakage. So you can definitely see the examples of the short and the long hair strands. And this is an example of alopecia areata in a male child. This is an example of traumatic alopecia, alopecia areata, which has progressed, is progressing into alopecia totalis. Now in this case, we were able to restore her hair completely. It took some time, but it did regrow. This is Kayla Staples. She developed alopecia, I saw her back in 2011. And since that time, now this is her where she lost all of her hair, and this is her with a wig. And she did have some of her hair to be restored, about 65%, the last time I saw her. So she is actually my essay winner from 2012, and I'll elaborate more about that when I talk about my cruise with a purpose. These 3 ladies all have alopecia totalis for various reasons, and they're all licensed cosmetologists. One of them lost her hair because she has systemic lupus. Another one was in an automobile accident when she was 4 years old, and her hair never grew back. She did have some trauma to the scalp. The other one, she lost her hair once her mother passed away, and it was very, very stressful for her, and her hair has never grown back. So even though you see a person where it looks like they all have the same form of alopecia, that is not the case. So that's why in my practice I take each person on a case-by-case basis. This is another example. Did any of you see the 2012 Olympics? This is the cycling team. This is one of the ladies who, once she removed her helmet, she was able to expose herself to the world that she also has alopecia. This is another beauty queen, Sandra Dubose. She has a combination of alopecia areata, alopecia universalis, and cicatricial alopecia. This is another beauty queen, Kayla Martell, and she also has alopecia areata. She's Miss Delaware of 2010. Alopecia is more than a conversation, it is a lifestyle for some individuals. So this particular lady, she has a very severe form of alopecia. Hers was irreversible. So I was able to get her scalp healthier, but as far as reversing her hair, that was not the case for her. I'm also a contributing writer for over 48 national magazine publications. And so some of the magazines that I write for, I'm going to share those with you. I also have my own radio show, which airs every Wednesday from 11 to 12 noon, 11 a.m. to 12 noon on dfwiradio.com. It's called Ask the Hair and Scalp Doctor. And I've had my show for over 2 years now. Why consult with a trichologist? We include different topics such as we look at body systems, biochemistry, and hair care processes, the anatomy and physiology of the hair and scalp, microscopy with 2 microscopes, nutrition, procedures for consultation, hair shaft problems, hair loss, scalp problems as well, and trichological preparations. Some of the magazines I've written for include these magazines. These are some of the other ones I've written for. These are some of the others. These are some natural hair publications. And these are 3 publications where I've been featured on the front covers. Help is available. Now I'm going to share with you some before and after pictures. Now this is a lady who came to me with very severe alopecia in this region. After I analyzed her, I told her that it was reversible. Her hair would grow back. So she came to me for treatments, and it took us 9 months, and we were able to completely restore her hair. Wow. So she's very, very pleased. And so this is just one of the ads that I have created. Get your hair back before and after of her case. This is another example of a young lady. Now she had 2 patchy areas of alopecia. One on the right side and one on the left side. So we put her on treatments, and this is the result after. And it took us 3 months to restore her hair. So she's happy. This is a young lady who had severe hair breakage, another category of alopecia. So she was not wanting to cut the longer strands here. So I advised her that she needed to cut her hair short. We needed to start over. And she did. We started her on treatments. It took us 4 months to completely restore her hair as well. Now this is a lady. She's over 50, and she came to me. She had severe lesions on her scalp here, as well as alopecia. So what we had to do was clear up her scalp first. So that's one thing that I always recommend to my patients. If there's a scalp condition, we need to address the scalp first and then address the hair loss, because a healthy scalp leads to healthy hair growth. So we were able to clear up her lesions here. It took us 3.5 weeks. So this is the after photo here. And then this is her regrowth. It took us 3 months to regrow her hair. So she's very pleased. This is another young lady. She had very thinning around, a lot of thinning around her frontal hairline area here. So that was her focus, if we could reverse her hair. And I told her it was reversible. And so this is after 4 months. We've seen significant improvements in her hairline area. This is another lady who's over 50. And we were able to restore her hair. When she came in, she was very, very thin here and here. And this is after 8 months of treatments and using my products. And we could see a significant improvement with restoring her hair. Now this is a young child, she's 11 years old. When her mother brought her to me, this is what her hair looked like. This is the before picture. This is after 2 months, we were able to see progress. And this is after 6 months. We were able to restore her hair completely as well. This is another example. I do not have her before picture, but she was complaining of thinning on the sides. So we were able to restore her hair in 3 months. This is another young lady, over 50. We were able to restore her hair. She was complaining of thinning in this region where she had alopecia. And this is after 5 months of treatment. And then she applied hair color.
Ooh.
This is another case. Now she had a severe scalp condition. She had just a minimal amount of alopecia, which was in this region, her nape area of the scalp. So we addressed her scalp, got that cleared up. It took us approximately 6 treatments to clear her scalp. She had a condition known as alopecia pityriasis amiantacea is what she had. So we were able to get that cleared up and then work on the alopecia. And this is her after picture. So she goes to the salon regularly, and she's come back periodically to tell me that her scalp is still doing extremely well. She hasn't had any other problems. This is another case. She was complaining of her nape area was very, what we call pruritus of the scalp, severe itching. She also had folliculitis of the scalp. So we were able to clear that up, and her hair began to grow immediately. So this is after 4 months of treatment. We've been able to restore her hair. This is another lady, she's over 50, and she was complaining of hair thinning, mainly in this region. I do not have her before picture, but she was complaining of thinning in this region, and after 10 months of treatments, we were able to restore her hair. And this is another young lady. She had some issues with chemical alopecia, so she cut her hair off. And so when she came to me, we began treatments and put her on my treatment therapy. And this is after 8 months, how much her hair has grown. And then she applied color. That's one thing about us ladies, we love hair color. Okay. Okay, and this is another example of a person with alopecia. This is the before. It took us about 2 years in this particular case. And this is the after picture. So her hair was reversible. I also have my own product line. This talks a little more about my entire product line. And as far as my hair care and skin care products, I actually hired a chemist. Her name is Tracy Ashley from Fort Worth. She did a wonderful job. So I sat down with Tracy. I told her what I needed my products to address. So the products are a support to my business. And She did a great job with my formula. My products have been out for over 8 years now. And they're in a lot of magazines. I've done a lot of marketing for my products. So this is just one advertisement for them. I have smaller packages that are available. I have the shampoo, my revitalizer conditioner, I have an anti-itch oil, as well as a leave-in conditioner. I also have a very customized oil for the pityriasis amiantacea, which is the most severe form of scaling of the scalp. So that's not something that's regularly in my packet. So that's something that is customized. My skincare products. I had so many patients coming in and they were complaining about eczema or their children having eczema. So that is a very, very large area that I told her needed to be addressed. So she came up with a formula for me, and it has worked wonderful for children as well as babies and adults. So we have a shower gel, we have an all-natural soap, as well as a hand and body cream. Okay, part of my philanthropy, giving back to children who are affected with alopecia. I started my Cruise with a Purpose in 2012, and my first child who received the scholarship was Kayla Staples. So these are actually some pictures from the cruise. So she received the award and the scholarship here. I also had a corporate award. Now this is, they started an organization called CAP, and this is let me think of her name. The Wyatovich is their last name. It'll come to me in a minute. But these were my corporate awards, and they have done a great job with the nonprofit organization to help kids also who are affected with alopecia. And now I'm doing my second Cruise with a Purpose. This was on my first cruise. I took a group of people on there and we had an absolutely wonderful time on the Cruise with a Purpose for alopecia awareness. My 2 essay winners from last year include Saina Giovanni. Saina is in the red dress. She's a senior this year. And Saina is a very gifted writer, and she actually would like to pursue journalism as her major. So she's very excited about that. The other young lady, she's 12 years old. And this is Maya Peppers. Okay? So they will both be receiving the scholarship this year. From my first Cruise with a Purpose, I wrote an icebreaker song. And I did not know that it was going to go over as well as it did. I did not see that coming. So I'm going to share that with you ladies as well. So from the icebreaker, all of my attendees, they encouraged me to go into the studio. I'm sorry, I'm trying not to make this, okay. They encouraged me to go into the studio and put that on a CD. So I connected with a world-renowned producer. His name is Victor Clark. And we collaborated, and the song came out in 2013. And then in 2014, I did a music video. Again, stepping out of the box. I did not see that coming. So these are pictures from one of the shoots that we did for the music video. Such a fun project. This is the back of my CD. Okay. My radio show advertisement, again, is on every Wednesday from 11 a.m. until 12 p.m. And that's the front of my CD. I also have my own Hair and Scalp University. This is a membership type of program. And I have a package for consumers as well as several packages for licensed professionals. And that includes a number of benefits, like you get a healthy, one of my articles for the month, a healthy hair care tip of the month, healthy scalp care tip of the month. You receive discounts on my products. You receive tickets to attend some of my educational seminars. There's just a whole list of benefits in that membership package. So if anyone is interested, let me know. Okay, get to Q&A, but first I'm going to go ahead and show you my video. Okay? Okay. Okay.
Turn it up? Okay.
Thank you, Dr. Amerson. Okay, I'm sorry, guys. We're going to do my favorite part, door prizes. Yay! Does everybody have door prize tickets? Anybody does not have a ticket? There's one over here, G. There's one right there.